Hi class, welcome to the online session. We are going to discuss on 4 slides, and this would be on the soft tissue malignancies. So we have slide 23, 22, 25, and 101. This would be rhabdomyosarcoma, that's slide 23, fibrosarcoma, slide 22, liposarcoma, slide 25, and slide 101, that's leiomyosarcoma. Slide 22, this is fibrosarcoma. And fibrosarcoma is a malignant tumor that is derived from the fibroblasts. Okay, so again, when you are going to be asked what is the origin of this particular tumor, you have to specify not just mesenchymal, but it should be stated as coming from the fibroblast or from fibrous tissue. So this has a not too good staining quality. This area would be pertaining to the squamous epithelium. What we have to look at would be in the particular area in the stroma. Okay, so this particular area. This is a nodule that would be seen at the dermal portion. So this would be the boundary or the margin of the nodule. You can see it's irregular. And then what would be very distinctive here would be the presence of spindle cells arranged in interweaving fascicles. Okay, so these are composed of spindle cells. Okay, so let's go to the high power magnification. These are composed of spindle cells. They have moderate pleomorphism. Okay, here you can see the presence of large nuclei, elongated, with prominence of the nucleolus or nucleoli. So this would be the presence of fibroblasts. The pink would refer to the dense collagen. So this is fibrosarcoma. Actually, the fibrosarcoma would be positive for vimentin. So when we are talking about malignant mesenchymal tumors, they would all be positive for vimentin. Okay, this one is a diagnosis by exclusion because the rest of the immunohistochemical markers would be negative for this particular tumor. Okay, so this is spindle cell in interweaving pattern. You can see the longitudinal and circular patterns, but they do not have the characteristic feature. Sometimes you would read that this particular tumor has the herringbone pattern. I think this is the one. You have the stroma, and then you have the herringbone appearance of the tumor cells. Okay, here you have another one. Okay, like this one, and then you have here the separation between this one and this portion. Okay, so that is what they would call as having the herringbone pattern. Okay, next is slide 23. This is rhabdomyosarcoma. If you're going to look at it in a high power magnification, you would see already the presence of large cells. So rhabdomyosarcoma, it's a malignant tumor that would arise from skeletal muscle. That's why it's called rhabdo. Okay, so this atypical cells are rhabdomyoblasts, and this is of the pleomorphic type because we have 3 variants for rhabdomyosarcoma. We have the pleomorphic, we have the embryonal, and then we have the alveolar. So this would be the pleomorphic because histologically we would see the presence of large cells like this. Okay, these are the large cells, having bizarre nuclear figures, abundant eosinophilic cytoplasm. So these are atypical rhabdomyoblasts. Okay, in order to differentiate this one from the other spindle cells, because sometimes they would also have marked pleomorphism, we would test on myogenin, which would be positive. We also would associate rhabdomysarcoma with PAX3 FOX01 fusion gene. Again, PAX3 FOX01 fusion gene. Okay. Next, we have liposarcoma. Liposarcoma is a malignant tumor derived from fats. So first thing that I have to show to you would be this cluster. So these are benign or normal adipose tissues or adipocytes. So always you try to see the presence of the margin. Okay, the nucleus would be very inconspicuous. When you say inconspicuous, they are very small. Okay, so sometimes you do not see where is that particular nucleus in this adipocyte. You can see it to be this one. Okay, and then this would be the abundant clear cytoplasm. Now let's go to the concerned area. So once you try to browse on other portions, you would see this particular area. Okay, so it is similar to the adipocytes before in the previous areas that I've shown to you, but this time you would notice that although you have the adipocyte looking cell with clear cytoplasm, abundant at that, you would see the presence of this larger nuclei. Okay, they are already prominent. You can readily identify them. Okay, but it's still peripherally located or eccentrically located, and these are lipoblasts. So these are atypical cells, and they are amplifying MDM2. Okay, there's MDM2 amplification for this particular tumor, liposarcoma, and immunohistochemistry, we can use S100. Okay. And then we have slide 101. This is leiomyosarcoma. Okay, so leiomyosarcoma is a malignant tumor that would be derived from, or that would arise from, this particular set of normal looking cells. This would be smooth muscle. Okay, so that would be your clue already. Okay, so when you see this one, presence of smooth muscle fibers, okay, those are not from the fibroblast. Those would be smooth muscle. So these are also examples of the smooth muscle. Okay, here. And then the atypical cells are present in between them. Okay, these are the cells of leiomyosarcoma. So leiomyosarcoma is a malignant tumor derived from smooth muscle fibers. They are spindle cells. Okay, they have marked pleomorphism. Okay, who's using 3D? Sorry. Okay. And then there's the presence of prominence of the nucleolus or nucleoli. And in order to, okay, so you have here the spindle cells. Okay. So again, you try to look at the other areas. This would be adjacent to smooth muscle fibers. So in order to differentiate it, this one from other spindle cell tumors, we use smooth muscle actin, that's SMA, and desmin to highlight the spindle cells. And if it's positive, then it's leiomyosarcoma. Okay, so those are the 4 slides for this session. I'm going to have a continuation, the last one, the last 2 slides, 256, and that's chondrosarcoma, and 54 lymphoma, maybe tomorrow because I do not have the slides here. I'm going to get it from the laboratory. Okay, so good night, stay safe.